Right here is the latest update about the situations of COVID-19 epidemic in Vietnam. Please use to follow. According to the Ministry of Health, at December 15th, Vietnam recorded 11,522,096 cases of COVID-19. The total number of cases of treatments is 10,610,055 cases. The number of severe patients being treated is 54 cases. Today, the country doesn't record the death of COVID-19. The total amount of vaccines have been injected is 265,077,045 doses. The New Zealand government has just passed a new law. Accordingly, the people of New Zealand in the future will be banned from buying cigarettes permanently. According to the anti-smoking law, which was just passed by New Zealand's National Assembly from January 1st, 2009, were banned from buying cigarettes permanently. The violator will be fined more than 95,000 USD, which also require reductions in nicotine content in tobacco products sold in New Zealand. The number of retail stores licensed to sell cigarettes has decreased by 19%. New Zealand is trying to become a smoke-free country in 2025. Hanoi Department of Health has just issued a plan to ensure safety against epidemic. Food safety and hygiene and medicines respond to the new year of the 2023, in which the emergency treatment is all days. According to the Department of Health require health needs to perform well the medical examinations, treatments, and emergencies at the hospitals, and readings to participate in the emergency rooms for extensive health response to all days. Along with that, the Hanoi Disease Control Centers has the task of closely monitoring the situations of epidemic situations, early detections of outbreaks to properly handle them thoroughly. The Department of Food Safety and Hygiene Hanoi developed a plan to check and supervise food safety and hygiene during the New Year, Lunar New Year, and festivals. At the end of the year, Children's Hospital in Ho Chi Minh City receives a treatment of many children with meningitis, including children who have serious complications that have to surgeries to take place in the brains many times. At the hospitals, Ho Chi Minh City from October until now, the number of patients coming to examine and treat meningitis suddenly increased with 20 to 25 cases per day. Among these, many children were hospitalized in the critical conditions. They have to mechanically treat antibiotics and treat about the cause of the disease. The doctor said that so far there have been no conditions. According to the current National Center of Hydrometeorological Forecasts in the north, there is a part of strong cold air moving to the south. From December 17th, in the north and the north central, the sky has moved coldly. The area from Quảng Bình to Quảng Ngãi is cold. People need to stay healthy in cold weather. Accordingly, from 17th to 23rd December, the north and north central regions is cold. The area from Quảng Bình to Quảng Ngãi is cold. Between 18th and 19th, the northern regions is likely to be cold. The northern mountains are likely to be below 0 degrees Celsius. The forest penis occurs. To ensure the health of people needs to wear clothes in many layers to keep the neck, ear, hands, regularly wash hands with soap, nose, and throat hygiene daily with salt water. And do not pass later or early in the morning to prevent stroke. Hanoi Medical University Hospital said that the hospital has just treated a 19-year-old patient often abdominal pains when eating intercompetitive gallbladder stone. This is a rare case due to all the patients with weak health infections. Laser laparoscopic doctor for skin lithotripsy for patients. This technique is a small incision of about 1 cm in the patient's back. Then leave a small tunnel through the skin to the period in contact with the paper to cleanse. After 5 days of lithotripsy, patient's health has gradually recovered. Last week, Hanoi recorded more than 1,300 cases of dengue fevers. Although compared to the peak of the epidemic, the number of cases has decreased, but with the sunny at day and cold weather at night, convenience for mosquitoes to develop, people should not be subjective with dengue fever.